Alright guys, so let's have it and talk about the concept of what? Gastric function test. Gastric function test, right? So this gastric function test is like is you just trying to say that you just want to talk about the whole concept, because gastric function test is supposed to actually have an S. It's not one, right? It's many things. Right? So, but the whole concept is that's the whole what do you call it? Purpose of doing this test is basically to assess the function of the stomach, then also identify what various gastrointestinal disorders that may actually come up, right? So looking at the type, we have the fractional meal test, right? This is an illustration of fractional meal test. This one said that a tube is inserted into the stomach to collect gastric contents after a standardized test meal. So you now analyze the volume, the acidity, and enzymes that are present in the gastric juice just to assess if gastric juice is being secreted appropriately when you eat a particular food. Do you understand? They also have the Pentagastrin Stimulation Test. This one will say that an injection of pentagastrin will stimulate gastric acid secretion. Alright. So you are basically trying to measure the amount of acid that is being secreted when you give pentagastrin. Alright. So you're trying to see if acid is being secreted appropriately or being secreted in little amounts. Do you understand? Then we have the tubeless gastric analysis. For this process is a non-invasive test using a radio-labeled substance to measure acid secretion, and this is based on how quickly the stomach empties. All right. This one you're trying to evaluate gastric acid secretion without the need for gastric intubation. Then examination of gastric contents. This one's gastric contents are collected after fasting to measure baseline acidity and volume. It helps to diagnose conditions like what chronic gastritis or gastric what carcinoma. All right. But purpose and application of all these tests now, all right, like basically all there is different ways, but their purpose is like the same, right? So you are trying to diagnose what gastrointestinal disorders, right? Trying to check out if there are presence of disease conditions like what um peptic ulcers, all right, atrophic gastritis, aclohydria, and all of that. Then you're also trying to assess for stomach function, also trying to monitor treatment efficacy. Probably are treating a patient, so you want to see how the patient is like recovering from all of that. Then um, common findings is basically what increased gastric acidity. So you see that probably the acid is too much, or if it is decreased, right? So if the acid is too much, now it will help you trying to like diagnose different conditions. You're also trying to see if there's presence of blood or bile. Then I'm trying to see if there's elevated levels and all of that. Okay. So guys, that's it for this, and see you guys pretty soon.